Dr. King, thank you for your time and for what you do. I appreciate it.
Thank you for having me today.
You know, my first question is just a general one. It's just to get you to confirm something I was thinking before the broadcast, and that's, sure, your specialty is sexual medicine and the health of men out there, but I bet that goes a long way toward having healthy families and relationships, because if you can get those issues resolved with the man, everything else falls into place, right?
Yes, absolutely. I look at erectile dysfunction as a couple's disease. It's not just the man or the male partner that's going through it. It's the couple as a whole that's dealing with this. It's also very important as the health of the individual as a whole. So I think of urologists as the first line for a lot of just overall cardiovascular health for men, because erectile dysfunction is the canary in the coal mine for coronary artery disease.
How young a patient have you ever seen walk through your door?
The youngest I would say is about 16, actually. He had a different reason. It was more of a trauma issue. As far as being like medically related, linked to diabetes, hypertension, heart disease, the youngest I've seen has been like 30. Especially with insulin-dependent diabetic patients, they can start to exhibit issues with erectile dysfunction pretty early in life.
Is it mostly erectile dysfunction? If I'm basing that assumption on the commercials I see, then that's all you all get in the urology field. Is that the bulk of it?
No, we also deal with Peyronies disease. There's been a recent commercial with Xiaflex where they talked about curvature of the penis. That's not as much related to like the overall health, but usually like a trauma, or if they have Dupuytren's contractures in their hands, then they can have that. But that is another thing we deal with. We also deal with infertility. There's been recent studies that have been shown that infertility is actually linked to cardiovascular disease, also with issues with prediabetes, insulin resistance, hypertension too. So I feel like we're like the gateway, because these are the things that'll bring men into the office. They don't always come in if they're having chest pain or if their sugars are high, because sometimes they don't even know. And we're the first line to get them to disease modification steps.
What's the common thread between those sexual issues, ED, Peyronies, and the other issues you mentioned, diabetes, heart disease? Does it all start with the vascular system of the human body?
Typically, it starts with diabetes or hypertension, and then you start to have injury to the vascular system. So, like I said, erectile dysfunction is the first, one of the first markers for endothelial damage, and that comes from either having high blood pressure where the blood is forcing up against the wall of the blood vessel and causing micro tears, or diabetes where the elevated sugars are causing damage to the vasculature, or it could also be high lipids where you're having deposits of lipids and cholesterol in the vasculature.
I want to talk about a couple of these issues certainly during the course of our conversation today, but I just want to ask you in general, did we ever even talk about this stuff before the advent of Cialis and Viagra and some of the other products we see? It seems like back in the day, and that wasn't too long ago, this was all pretty hush-hush. Is that true?
Yes. Usually men would eventually bring it up to their primary care doctors, and then they would usher them over to urology. But it became widespread once Cialis and Viagra came out. But to be clear, there have been treatments for erectile dysfunction well before that. You had the injections, and then we also had the penile implant, which came out in like the 70s.
Talk about some key ways that men can know that it might be time to mention it to their primary care physician or to go to a urologist directly. Is it just after one or two times when an encounter with your partner doesn't go well? How do we know when, okay, we need to get this checked out?
I would say after a couple of times and you start noticing that it's becoming a pattern, that's definitely a marker. Some men, they come into this vicious cycle, so they can't get an erection and they get anxious about getting one the next time, and then it just snowballs. So I also like to get sex therapists involved to help bring the psychologic portion into it. Because if you have really high anxiety, you're going to increase your adrenaline levels and epinephrine, and then what happens is that fights your erections. So it's I would say in the first couple of times when you start to see a pattern, and it doesn't have to be just not being able to achieve one. It's either you can't achieve one, you're not maintaining long enough to be able to have intercourse.
How long does it take till you can fix this, till you can get somebody back on the road to better sexual health?
It depends. I let the patient be the driving force to that. Some people need a little bit more hand holding and discussing the options and going through it in a systematic fashion. Typically, I like to try, so like if I look at my algorithm of treatment of ED, I try pills first. If those don't work on a consistent basis, then we move to injections. And if that doesn't work, then we move on to surgical options, which is the penile implant.
You know, you sound like someone who, thank goodness, treats the whole person instead of just the specific
Yes.
issue. I would suspect, though, Dr. King, a lot of people come to urologists and just say, I've seen the ads. Please give me the pill and I'll be on my way. So how do you convince them to move past that and say, wait a second, this runs deeper than just popping a pill to fix it?
I typically I'll inquire if they come to me and they do not have a primary care physician, because some I do get self referrals. I'll make sure that they don't leave my office without one. They'll be seeing somebody in our system at least, just so we can get them checked out to make sure there's nothing else going on. If I have a hard time convincing the patient, then I'll have them bring their partner in. Typically, you know, we don't take care of ourselves as much as we should, but when our loved ones are the ones that'll kind of convince us, like, hey, you really should go get checked out for other things,
You know,
especially if they come in with no diagnoses and we need to figure out what's going on.
I know I asked you about, your youngest patient, but what typically is the age when you see the onset, if that's even the right word, of erectile dysfunction? Is it our 30s, our 40s? What do you see out there?
I see some men that'll start having issues in their mid 40s to early 50s. There's a like a percentage I always give patients. So if you have 100 men that are 50 years old, half of them are going to have erectile dysfunction. If you have 160-year-olds, 60%, and it keeps going up as you go up every decade. So I would say usually men will start seeing it around mid 40s, and going into their 50s.
Can a man's sexual health impact his lifespan? We see studies where women on average live longer than men. Can a man's sexual health, if it's good, help him live longer?
It's hard to say is it sexual health itself, but it's the indicator that since he has good sexual health, that means he probably doesn't have all the cardiovascular disease, the diabetes, and the hypertension. And again, that's why we're like the first line sometimes, because men don't like to go, not all men, but some men don't like to go to the doctor. And them not being able to perform will definitely get them in to see someone.
We are having a conversation about men's health, men's sexual health in particular, with Augusta urologist Dr. Sherita King on the Means Report. More topics important to men and their loved ones for their overall health when the Means Report continues. We'll be right back. Welcome back to the Means Report. We're talking about men's health today, in particular men's sexual well-being, and Dr. Sherita King is a urologist with Augusta University Health, kind enough to join us today. Let me pick back up, Dr. King, on a topic we were talking about before we went to the break, and that's that a man's sexual health can be an indicator of other issues, cardiovascular disease, diabetes. So let's go at it this way. If you can treat a man for diabetes, because you find out, okay, you have this, which is impacting your performance. Can you address the diabetes and then the sexual function returns without a pill, without treatment in that area?
It's not so much that it'll completely return, because what happens is you start to have damage to the tissues, and that's what's going on. So when you start to have erectile dysfunction, it's a symptom of other diseases. And just treating the diabetes, yes, you will prevent hopefully worsening of the erectile dysfunction, but it's not so much that I can reverse the changes that have already happened. That's why it's very important that people take care of themselves early on in life and form good habits so they won't unfortunately get these diseases that lead to sexual dysfunction.
All right, in our last segment, you mentioned Peyronies disease, curvature
Mm-hmm.
of the penis. Is that something that somebody might be born with, or is it because of an injury?
So Peyronie's disease itself infers that you're having an injury to it, and it's not something you're born with, so it's not congenital. There is congenital curvature of the penis that's called chordee, and that's usually pointed downward. But with Peyronie's disease, typically what I see is men who have had injury during intercourse. Either they missed when they were trying to penetrate,
Yeah.
or they weren't rigid enough to be able to penetrate smoothly, and then they end up having a bend in the penis. And the way it works is that once you get that bend, you start to have a tear within the tunica albuginea. That's the covering of the erectile chambers, and you bleed into the surrounding structures, and you form a scar. So basically, your body's forming a scab, but it's in a place that it just perpetuates and gets worse and doesn't really go away.
In most cases, with the proper treatment, can you return everything to the way it was?
Yeah, so the good thing about Peyronie's disease now is we have an FDA approved treatment for that, and that is Xiaflex. It's a collagenase. That means that basically it just breaks down, acts like a Pac-Man, and it breaks down that scar tissue. That way, it allows it to expand back out instead of being a jumbled mess. And then you won't have the curvature once you get the erection.
What about prostate issues? How can you tell if it's time to go see a doctor? Is it just frequent urination? Is that the number one indicator at home?
Typically, it's more of not being able to completely empty, or feeling that you're having a strain to start, or you're having a slow, weak stream,
Yeah.
or getting up a lot at night. Those are the typical signs of enlarging prostate.
You know, somebody may have those indicators and be reluctant to go to the doctor because they don't want to find out that they have cancer. That's not necessarily always going to be the case, right?
No, typically, prostate cancer, by the time when we diagnose it, you don't have any symptoms, and that's because of when they started doing PSA checks. We no longer are getting patients after the fact. So when they get so bad that the cancer is spread to other organs, and now they're having major symptoms from it.
What about if you do have to get treated for prostate cancer, as so many men are these days, or bladder issues, or colon issues? That can impact sexual function, can't it? And and how much optimism can you give us when it comes to being able to get back to a normal life after that?
Yeah, so absolutely. Any of those types of surgeries for bladder cancer, colon cancer, or prostate cancer, or any of the treatment. So even like the radiation that some people get for those cancers can lead to erectile dysfunction and start to leak urine. The reason why is the nerves that control the erections and your continence, so being able to hold urine, run right along all of those structures. So if you have surgery or radiation, it can cause injury or damage to those nerves, and that's where you start to have the issues. But the silver lining is, as long as you go to a place where they have like a cancer survivorship program, where they're dedicated to making sure that yes, we got your cancer, but we're going to get you back to our normal life, then you should be fine. There's lots of different things that I implement immediately post-op, including like a penile rehab program where I'm trying to keep the tissues of the penis as healthy as possible. So when you do recover your nerves, then you'll be able to achieve erections again. And then if that doesn't work, then we have, like I said, the whole host of different treatment options. So my message to men is that you should not keep the potential of having sexual dysfunction or leaking urine as a deterrent for getting treatment for your cancer. Because even if you have those things post-op, we can definitely treat you.
You know, I talked to some men before I did this interview, and I'll tell you this, sometimes they say they'll urinate they'll finish and they'll return to their desk or whatever they were doing, and they'll find out they weren't finished. That just a little bit more comes out. Do they have a I mean, can you almost guarantee they have a prostate problem, or can that just happen randomly anyway?
So urination is a little is very complex. So it could be that their prostate is growing, and that way it's blocking the complete emptying of their bladder, or it could be a dysfunction in the bladder wall itself with contracting and being able to expel all the urine that is in the bladder. The best thing to do is, if you're having those issues, to bring it up to your primary care doctor and then have them see a urologist.
We've been talking a lot about commercials, Dr. King, advertisements that we see all over the place. Treatments for low testosterone are certainly high among those. Again, same question, how can you tell when you might have low testosterone? What sort of daily impact might it have where you'd know I better see somebody?
So some of the main symptoms that will bring men in will be low libido and erectile dysfunction. But once I talk to them and like start asking them, like, are you having low energy? And they'll be like, yeah, absolutely. Or some people even have problems with cognition, being able to focus on a task. All these things depend on testosterone for you to be able to get through your day.
What do you think about all those products that promise to boost it? Is there a magic pill? I know that's probably a term you don't use clinically, but is there a low testosterone treatment that you take and your life immediately changes?
So a lot of the over-counter medications that they have out there, I warn patients to be very wary of them, because you don't really know what's in those things. They're not FDA approved, they're not regulated usually, so you can't tell what's in it. And some people have had some very scary side effects from some of those over-the-counter meds, or the things you see on late night TV trying to get men to buy them.
Yeah.
Yes, there are treatments that are available that are FDA approved, definitely. With testosterone, typically I will either do a topical gel that they'll apply either to the arm, chest, or underarm, or you can do injections of testosterone either weekly or every 2 weeks, or you can get pellets implanted, and those usually last about 3 to 6 months. It depends on how quickly your body breaks it down. But there's definitely ways that we can treat it. I would say stick to the FDA approved treatment options, though.
I've heard about that gel. Have you prescribed that and someone comes back and says, Dr. King, you changed my life?
Yes, absolutely.
Wow.
Absolutely. And everybody's a little different. It's just like people like different brands of tennis shoes. Whatever works best for you, I'm happy to provide that service.
How old can a man be and still have sex?
Let's see, the oldest patient I've ever put a penile implant in, I think, was 85.
Wow,
so,
85.
Yeah, he was a spry 85, and his wife was a little bit younger. But yeah, as long as you are heart healthy enough to engage in intercourse, I will do everything in my power to get you there.
Well, that's great advice. And just to wrap things up, as you said at the beginning of this interview, Dr. King, it can help the whole family be healthier, right?
Absolutely. When a patient is happy throughout his whole life, and including his sexual function, that exudes that, and his family knows that, and it's just a happier situation for most.
Well, that's well said. Dr. Sherita King, thank you for all you do for the men in our lives, and thank you for being with us today.
Thank you. Thank you for having me.
Yes, ma'am. We appreciate you.